Dr. Harris, I have to begin with this new report that our correspondent Philip Crowther also mentioned. The entire population of Gaza, more than 2 million people, facing hunger, and the risk of famine is increasing every single day. Where do things stand? What are you hearing about the situation on the ground when it comes to famine and hunger? And are aid convoys at this point even getting in, because there is no pause in hostilities?
Yes, thank you. You've explained it very well. Now, this is a report called the Integrated Food Security Phase Classification. They look at the evidence, and they have said, and we contribute to it, they have said that this is the greatest number of people they have ever classified as in food crisis. It's an unprecedented 93% of the population is facing crisis levels of hunger, which means everybody basically is going to bed hungry. And as your correspondent mentioned, at least 1 in 4 households are in the highest level of starvation, called catastrophic, level 5, where they really just do not have food. And the risk of famine, and there's never been a famine as big as this, is very, very high. And the worst part of this is it's an entirely man-made famine. You know, it's because food, as you mentioned, as we said, cannot get in. And even if we can get it in, distributing it, particularly in the north, is extremely difficult and extremely dangerous. We are bringing aid, but we bring in medical supplies. That's what we bring in. And when we bring in medicine, our trucks are surrounded. And we have to say, sorry, it's medicine, not food.
And you bring up medicine. That brings me to my next question. The situation with hospitals, northern Gaza, from what the WHO is saying, no longer has functioning hospitals?
This is correct. This is because they've been so damaged, and the staff have either been arrested, have been detained, or the staff have been killed, or the staff have had to be displaced with their families to the south. And even if the staff, what staff are there, don't have enough power, don't have enough supplies, or simply don't have the skills to do procedures. None of the operating theatres are working. My colleagues went to Asieh and basically said, it said it was functioning more as a hospice. There were people there were people doing what they can, but there's very little they can do beyond manage those people who are there, try to give them some kind of support. But essentially what we're looking at right now are dying rooms. People are there simply waiting to die.
Dr. Harris, I know you know what the Israelis are saying about some of these hospitals, including Gaza's largest, Al-Shifa. They're saying Hamas is using these structures as command and control centers. It says they have discovered tunnels and weapons. I know you're a physician, you work for the WHO, but can you just tell me what you're hearing from your partners, your teams on the ground who've been to some of these hospitals? Is there any evidence that these hospitals, including Al-Shifa, are being used as command and control centers for Hamas?
So you're quite right. We are physicians, we are doctors. So we go to look at healthcare and look at what we can do to support healthcare. We're not criminal investigators, we're not military experts. But having said all that, we have not seen anything but healthcare workers overwhelmed by hundreds of thousands of patients whom they now lack the supplies or the means of helping. So all we're seeing is a desperate need for healthcare that is becoming more and more difficult to meet. We are not seeing anything beyond healthcare workers trying to help, desperately trying to help people.
And Dr. Harris, this crisis is just going to keep getting worse and worse unless there's another pause in fighting, another suspension in hostilities. How important is it for all sides at the United Nations, at talks in Egypt, for all sides to agree to put a kibosh on it, if you will, at least temporarily, to relieve the suffering for so many people hurting in Gaza right now?
It's absolutely critical. Nobody's winning this. Nobody's winning here. the world is losing. We're losing our moral compass because we are standing by and watching people starve to death. If they're not killed by the bombs, they're killed slowly by starvation and disease. This is not a win. This cannot be an objective in anybody's lexicon. The only answer here is a ceasefire. And honestly, it's very difficult for us to understand how there can be any other argument. This is about humanity. We're going into a time when the world celebrates hope, the birth of a child under difficult circumstances. Perhaps we can recognize what this period, this time means, and bring some hope to the children of Gaza.
Well, we certainly hope. Dr. Margaret Harris, is always a pleasure. Thank you for joining us.